Hi, I'm Scott Green and I'm a plastic surgeon at the Plastic Surgery Center, and this is Stacy Lassiter. She's our physician's assistant. She's important in all parts of your surgical care here at the Plastic Surgery Center. Today, we're going to talk about thigh lifts. Now there's a few different types of thigh lifts. There's inner thigh lifts and there's outer thigh lifts. Very different procedures. These procedures are typically performed on patients who have had significant weight loss, but not always. A man named Theodore Lockwood, a plastic surgeon out of Kansas, first sort of started pioneering these procedures back in the early 90s, and in my opinion, really perfected them. His techniques and his ideas really have influenced the way we do all of our procedures today regarding weight loss patients. And thigh lifts are certainly one of them that he had a great deal of influence in. Let's talk about inner thigh lifts first. Inner thigh lifts, there's two main types of inner thigh lifts. And when we're thinking about inner thigh lifts, we're speaking about the area of skin that's on the inside area of your thigh, right by your groin. That area is commonly a little thinner, the skin is, and that thinner skin tends to stretch out easier and become lax and sometimes sag. And when we've gained weight and lost weight, that can be real significant. And that sag can occur just in the upper thigh groin area, or it can occur all the way down to the knee. I have sort of separated these two out into what I call a type 1 thigh lift and a type 2 thigh lift. A type 1 thigh lift is where we are making an incision just in the groin area, liposuctioning that inner thigh area and pulling that tissue upward and hooking it back to the groin area. That's when that problem is really confined mostly to the upper third of the inner thigh. When we have a problem in the middle third or the lower third of the inner thigh, then we have to do what I call a type 2 thigh lift, and that is very much like a pant seam incision. This type of incision you'd have if you made an incision along the inside edge of your pant seam on your trousers. So that incision would go down to your knee and extend all the way up to your groin area. It may or may not involve a transverse incision in the groin area. These two surgeries are really designed to take away extra fatty tissue from the inner thigh and the anterior thigh and the extra skin in those areas. But it doesn't have much effect on the outer thigh, hip, or butt area. That is a different type of thigh lift, and in fact, that's how I actually record it when I tell my patient coordinator what we're going to be doing. I tell them that we're going to be doing a hip, thigh, butt lift. That's usually when we have extra fatty tissue in that lateral thigh area, kind of our saddlebag area, or extra sag in our buttocks. That's when we do an outer thigh, hip, and butt lift. And that was one of those procedures that Theodore Lockwood was really prominent in pioneering. He often combined that procedure with a tummy tuck called a lower body lift. In that thigh lift procedure, typically what we will do is we will have you laying on your tummy in the beginning of the procedure. And during that, we will inject everything with a tumescent solution, which prevents bleeding. We'll do our liposuction, and then we'll remove the extra skin and fatty tissue from your buttocks and from your lateral hip and pull that up into its new position. Sometimes we'll remove as much as 23 vertical centimeters out of your lateral thigh. So if you go measure that on yourself, you'll see what a significant change that can make for somebody. In addition to the liposuction, we can usually completely remove that saddlebag area and that unwanted extra fatty tissue in the lateral thigh. Once we've done that on both sides, then we'll typically turn you back over where you're laying on your back, and we'll connect that incision to the front of your hip, what's called your anterior iliac spine. So that incision will kind of come around the front of your body to the front of your pelvic area, and you can feel your pelvic bone right there on your side. That's usually where that incision terminates, unless, of course, we are doing this surgery at the same time we're doing a tummy tuck, as in a lower body lift, and then we'll just blend that incision right into your lower tummy incision. This whole surgery takes about 4 or 4.5 hours, and so you'll be with us in our surgery center for a total of about 6.5 or 7 hours between your time you're admitted, your surgical time, and your post-op recovery time in our PACU. After that, we'll send you home. Now that might sound surprising that we would send you home after a big surgery like this, but in truth, it's the best thing for you. Surgeries in hospitals carry additional risks, and so outpatient surgery centers actually prevent a lot of the risks that we see in hospitals. Hospitals have a higher rate of blood clots, a higher rate of infections, and even infections acquired in those hospital centers because they take care of patients often who are sick. Where at outpatient surgery centers, we're taking care of patients who are healthy all the time. After you go home, we want you walking that day in your home, and the next day outside, the next day down the block, and the day after that around the block. Walking helps you prevent things like blood clots. Blood clots are one of the few complications we can have in these types of surgeries. We want to make sure there's zero chance for those blood clots to occur. So we do a couple of things. We send you home with squeezy boots for your legs. Squeezy boots are also called sequential compression devices. And sequential compression devices are pneumatic devices that are applied to your calf area, and they pump blood back to your system when you're laying down and resting. So you should have those on at all times that you're laying down and resting. That being said, we want to make sure you're up walking every couple hours pretty regularly and increasing your walking each day. That's important for that, and it's very important for one other reason, and that is you'll feel better the more you walk. The more you move, the better you feel and the less pain you have. So the more walking you do, the faster you'll recover. Typically after a day, you'll be coming back to see us post-op. We'll check out everything and make sure that everything's going well. You usually will turn in your sequential compression devices at that point, so long as you're walking enough. If not, we'll probably make you wear them for another couple days. And we'll usually see you back a few days later just to make sure things are going along well. We also put you in a compression garment after we do our procedure on you, and that compression garment is put on to try and help reduce swelling. Swelling causes pain, and so pain usually keeps people from moving. We're trying to do all we can to reduce your pain and get you moving so you have a speedy recovery. Usually it's important with these procedures for the first few days to have somebody at home who's responsible and old enough to really help you and take care of you. And you'll probably need help with simple things for the first few days. Things like just getting out of bed, or getting into the bathroom to go to the bathroom, or taking a shower or a bath. So you'll need that person those first few days to do that. And sometimes even doing simple things like bringing you food that first day. But the more you get up and walk, the faster you'll be able to do these things for yourself. And we really, truly expect that by day 3, you're going to be on your way to recovery and doing all of those things on your own without additional help. With a thigh lift, usually it takes until about a week before you're driving a car and about a week before you're off pain medicine. On occasion, we will place drains when we do thigh lifts. Most of the time not, but sometimes when it's combined with a tummy incision, we do. And those drains will usually come out about a week. We tell you can go back to work at about 2 weeks. Go back to exercise at 3 weeks. There will be some exercises we prevent you from doing, ones that put a lot of stress and strain on the incision, and we'll give you additional information on that while you're recovering. At 6 weeks, you don't need your compression garment anymore, and you'll be on your way to a speedy recovery and a brand new life with your thigh lift.